On 12th July 2021, President Museveni wrote to the Ministry of Health directing the Health Service Commission to recruit the medical workers who had voluntarily treated COVID-19 patients at the height of the pandemic. At that time, the Ministry of Health started conducting a verification exercise and interviews of the said health workers. However, on 18th March this year, the Ministry of Health Permanent Secretary Dr. Diana Atwine wrote a letter terminating these health workers' contracts, putting a spanner in the works. This, according to some of the affected health workers whom we interfaced with this morning.
And actually, this letter was a social media letter, which we thought maybe this is a rumor as social media letters, until when the hospital directors started chasing people who are staying in the hospital premises, and they say we were terminated.
Felt used and dumped. We felt heartbroken, and we felt that we are actually being treated as foreigners. Whereas in other countries, people who have served at the pandemic are being celebrated.
Now, many of these health workers have been sitting at home, pondering their next move.
As the affected COVID-19 staff, we are over 652, all cadres, including the anesthesiologists, medical officers, nursing officers, ambulance drivers, and oxygen plant operators.
However, there is now a spark of hope for these health workers following the President's call last evening for his directive to be implemented. While hosting a dinner for the Muslim community at State House in Entebbe last night, President Museveni reiterated the importance of ensuring that this health workers' sacrifice does not go to waste.
Temporarily, they will be hired. I told them that they should be hired. The only problem will be whether they have the money to pay them now because of the budget. But in any case, I told the government people that we need to take more health workers to the sub-county.
The health workers say that they are willing to start working right away. However, they say that the Ministry of Health must have a 30 billion wage bill ready for them.
We need 30 billion to take us through for the next financial year. As per the presidential directive, if that 30 billion is availed, all this staff can actually go back to their work with immediate effect. That is 1st May.
Because as I talk now, all the doctors, the nurses, and all other staff are committed to working in their respective places. Because some places, like these up-country places, which originally never had people to work in, but people since COVID were committed, even now they are committed.
The leadership of Uganda Medical Association has welcomed this directive.
As Uganda Medical Association, we are going to follow up this matter and ensure that all the health workers who are terminated, who are working on COVID patients, their contracts are reinstated, and the process which was already ongoing by the public service to evaluate them, for them to do the interviews, continues, and it is finalized.
In response, the Health Service Commission has revealed that the implementation of the President's directive is already underway. However, the absence of vacancies for the health workers, as well as money to pay their salaries, is slowing down the process.
But you'll realize that some of the positions, for example, those of a degree nurse and oxygen plant operators and ambulance assistants, do not exist in the normal staffing, normal structure of hospitals, so we cannot appoint them to non-existent positions.
Joyce Nakato, NTV Weekend Edition.